Hi there, welcome back to my YouTube channel. Today we are going to talk about arthritis. So let's talk about etymology first. Arth is stands for joint and itis stands for inflammation. So what it is, arthritis is inflammation of joint. So let's start our topic with introduction of arthritis. Arthritis refers to inflammation of one or more joints that leads to pain, stiffness and decreased range of motion. So basically it is inflammation that causes pain, stiffness and decreased range of motion caused by the joint. So it is a broad term that encompasses over 100 different conditions. So this thing is important. It is a broad term. It is basically the broad term, like it is inflammation of joint that can be caused because of any reason. Because of any reason, if inflammation of joint is there, we are gonna call it arthritis. Let's talk about the types of arthritis. So the first type is osteoarthritis. The second important type is rheumatoid arthritis. Then we have psoriatic arthritis, juvenile arthritis, ankylosing spondylitis. Now let's start our topic with osteoarthritis. Osteoarthritis is often called as wear and tear arthritis. It is caused by cartilage degeneration due to aging and repetitive use or injury. Symptoms of this include joint pain, stiffness, reduced mobility, commonly affecting knees, hips, hands, and spines. The second important type of arthritis is rheumatoid arthritis. That is autoimmune disease where the immune system mistakenly attacks the synovium. That is basically the lining of joint. That leads to inflammation, pain, and damage to cartilage and bone, and it can also affect other organs. That may be systemic involvement may be there. So the next important type of arthritis is psoriatic arthritis. That is associated with psoriasis, that is a skin condition, and that causes joint inflammation and can affect finger, toes, spine, and sacroiliac joints. The next important type of arthritis is juvenile arthritis. That is a type of arthritis affecting children with various subtypes, including juvenile idiopathic arthritis. Then important type of arthritis is another important type of arthritis is ankylosing spondylitis. That is a type of arthritis that affects spine and sacroiliac joints. It often leads to stiffness and fusion of vertebrae. Now let's talk about the symptoms of arthritis. The symptoms include pain and tenderness in affected joints. It includes stiffness, especially in the morning or after periods of inactivity. Then it may include swelling and redness around the joint, that is the one of the symptom of inflammation, and decreased range of motion is there in the arthritis. Then there's fatigue and malaise that is more common in autoimmune arthritis like rheumatoid arthritis. Now let's talk about the causes and risk factors of arthritis. Causes and risk factors include age. The risk of arthritis increases with age. Now let's talk about the genetics. Some forms like rheumatoid arthritis and ankylosing spondylitis have genetic links. Now, then the lifestyle, if we talk about lifestyle of arthritis, then obesity, repetitive joint strain, and smoking can cause increased risk of arthritis. Then if we talk about infections or injuries and arthritis, then it may trigger infection or injuries may trigger certain types of react like arthritis that are reactive like osteoarthritis, etc. Now let's talk about the diagnosis of arthritis, how we are gonna diagnose this. The first thing we do is clinical examination, that is checking joint tenderness, swelling and range of motion. Then we can also do imaging x-rays, that includes x-rays, MRI, ultrasound to assess joint damage and inflammation. Then we can also do laboratory tests, that is blood tests for markers like rheumatoid factor, anti-CCP antibodies or uric acid level. Then we can also do synovial fluid analysis, that is identifying infection crystals or inflammation. So this is how we diagnose arthritis or and we diagnose what type of arthritis it is. Now let's talk about treatment of arthritis, how we treat it. First we do medications that may include NSAIDs, that are non-steroidal anti-inflammatory drugs for pain and inflammation. Then the medication may include DMARDs, that are disease-modifying anti-rheumatic drugs for autoimmune types like rheumatoid arthritis. Then we can also give in medication corticosteroids for severe inflammation, and biological agents for advanced autoimmune arthritis can also be given. Then we can also do physical therapy, that is strengthening muscles and improving mobility, and lifestyle changes, that is healthy diet and also maintaining a proper weight, and regular exercise is suggested. Then we can also do surgery where we replace the joint for severe osteoarthritis or damage. So the next slide. How we can prevent arthritis. Maintaining a healthy weight to reduce joint strain is one of the factors that can prevent arthritis, especially if it is due to high weight or obese weight. So the other thing we can do is staying physically active to strengthen joint and muscles. Can also avoid arthritis, avoiding injury and managing if there is injury. Managing them properly is also included in preventive measures for arthritis. Then we can also do early treatment of autoimmune conditions to prevent progression of arthritis. So this was all about arthritis. If you like our video, don't forget to like, share, subscribe and comment. Thank you for watching.